You know, I'm thinking about important stuff, and you guys are saying this thing in like, what did they just say? Okay. Processing. All right, this is a femur. The femur is one of our left rights. All right, so the head of the femur definitely points in to the acetabulum. So then I got to figure out, hey, is it this way or is it that way? Well, the other major feature is the intercondylar notch or fossa. That big gap goes behind, posterior. So that's got to be a left. And yes, you can pick these up off the table and put them on your own body to figure these things out. Not a problem. All right, so parts. I already said the head. Here's the neck. Again, this is typically where the break occurs for a hip. It's usually the neck of the femur. The os coxae really has very little to do with it other than it's the receiving side. So they typically put the rod in here and put a polyethylene cap there, and they may or may not replace the acetabulum area for the cavity, but that's how that works. All right, big bump above, superior, greater trochanter, lower one, lesser trochanter. Greater, lesser, much more differentiation there. The linea aspera is a line, if you will, an edge, but the edge for the femur is on the back side, the posterior side. So the front will be very rounded, but the back side, the posterior side, will have kind of an edge to it, linea aspera. These must be the condyles, articulating with the tibia, and because this is a left, this must be the lateral condyle, this must be the medial condyle. Lateral out, medial closer to midline, and as I said before, between the condyles, intercondylar notch or fossa, and above the condyles, lateral and medial epicondyles. Lateral, medial epicondyles. Are those all the parts of it? Patella, that's the knee bone. Too simple to put in an exam. But who knows, right? Depends if I want to give you a gimme. Gimmes are good. All right, tibia. So the tibia, you don't have to know left versus right, but practically by the time it's said and done, you're going to know it. The tibia is your inside lower leg, inside or medial. So it turns out that this bump has to be on the inside. That makes it the medial malleolus. And this is your inside ankle bump, that big egg-like shaped thing that goes to the inside, medial malleolus. Therefore, the condyle above it must be the medial condyle. And therefore, the one next to that is, of course, the lateral condyle. So you pretty much have to shake this up to remember it's left or right, because you got to get your medials to the middle. Tibial tuberosity, big bump here. This would be somewhere below the knee, the patella. You can kind of feel that below that surface. Big attachment point for tendons and ligaments involved with this joint. And then the edge on the tibia is at the front. You know how it is, that shin area, you're always running into things. Mine is like, got big old notches in it from many, many times where I've done that. So this is called the anterior crest or border. And if you're familiar with the idea of shin splints are really the idea that the muscle that's attached to this area separates from the bone.
So it's not
Very
actually
painful. Yeah, it's not really microfractures or anything. It's really the separation of the two and with the connective tissue there. And of course, this isn't named, but this would be the surface that articulates with that talus in the foot. And then the fibula. Fibula. The arrow goes down. It's the outside lower leg. So we know this would be the lateral malleolus. And the other end is just called the head. So once you get the arrow pointing down, then the opposite end is the head. And that's it for it. Now, I always point this out. Sometimes I wonder, by pointing it out, it leads you to the mistake that's made. But don't forget, this is the tibia, and this is the fibula. I get oftentimes on exams that this is the tibula, and this is the fibia. No, tibia, tibia, tibia.